Hello doctors, students of homeopathy and friends of homeopathy. Today is the 1786th day of uninterrupted daily webinar of IFPH. And today our guest is Dr. VAIDEHI K, BHATT, Head of the Department and Professor of Department of Homeopathic Pharmacy, LR Homeopathic College, Rajkot. As a clinician, she is working as the she's working as a consultant in the homeopathic OPD of LR Homeopathic College, Rajkot, and owns her own clinic at VAIDEHI True Healthcare. She is a very proficient administrator, trainer, and writer. Published a lot of research papers. And today is the second part of Healing Young Minds: Homeopathic Insights into Childhood Behavioral Disorders. Let's welcome Dr. VAIDEHI K, BHATT, and welcome you all for the session.
Good evening, one and all present on the platform. Thank you, sir, for the introduction. Thank you, Sahani.
You are audible. You are audible. Continue, ma'am.
Okay. So today we complete the remaining portion of our first session regarding the behavior disorder. My screen is visible to you.
Yeah,
Yes,
it is visible. Now you can start.
So today is again a second part of Healing Young Minds: Homeopathic Insights into the Childhood Behavior Disorders. So as we know, behavior disorders are the persistent pattern of the disruptive, impulsive, aggressive, and socially inappropriate behavior. And it is not age appropriate and interfere with the normal development. So some common behavior disorders and children, as we discussed, that are the ADHD, oppositional deficient disorder, conduct disorders, autism spectrum disorders, anxiety disorders, depressive disorders, learning disabilities, obsessive compulsive disorders, and tic disorders. So various causes and contributory factors are there. In detail, we have discussed the factors in our last lecture. So just remember again the various factors related with it. There are the biological factors related with the genetic pattern, prenatal and perinatal factors. It is regarding the intrauterine life. Then the social academic pressure, then psychological factors. Some environmental factors plays a role, then lifestyle and technological factors, family factors, and nutritional and medical issues. As we discussed, our homeopathic approach, in homeopathy, we are taking person as a whole. So here we take the mental state, physical symptoms, behavior pattern for the remedy selections. So child's complete constitution, personality trait, past illness, and family tendencies are matters for the remedy selections. So our goal is not only to suppress the symptoms, but to stimulate the body's own healing abilities. We never forget contribution of miasm in development of any disorder. So here our 4 miasm plays a role. Related with the Sora, there will be insecurity, fearfulness, inferiority complex. In the psychosis, obsessiveness, impulsiveness, secretive behavior as seen in autism spectrum disorder and in OCD.
Excuse me, let me interfere, right? We need to, your slides are not moving and you need to check that. Yeah.
Sir, it is on.
It's on, but the slides are not moving. You need to click and make it.
Just a second, sir.
And we can make it full screen also if it's needed. There's an icon, we can make it.
Now it is visible, sir?
Yeah, it's visible. It's visible. Yeah, we need to just move that slides. That's all. Okay.
Okay, sir. Sir, with full screen, I get there is something problem with the full screen.
It's okay.
So I can this pattern only.
Yeah, sure.
Okay, sir. Thank you, sir. So various type of behavior disorders are there as we discuss. around 8 to 9 varieties of disorders are there. Then causes and contributory factors. So as we discussed in our earlier sessions, various contributory factors are there which are contributing the illness or behavior pattern of the children. Then as we comes in the holistic and individualistic approach, sir, it is visible, holistic and individualistic approach.
Yes, it's visible.
Okay, thank you, sir. So in homeopathy, we consider patient as a whole. So here also we take mental state, physical symptoms and behavior patterns. So for the remedy selection, understanding of child's complete constitution, personality trait, past illness and family tendency matters a lot. So our goal is not to suppress the symptoms, but to stimulate the body's own healing ability and bring about the balance in all levels. So we never forget to consider our miasmatic influences in every disease condition. So here also in SORA, there is the insecurity, fearfulness, inferiority complex, and psychosis, obsessiveness, impulsiveness, secretive behavior, and syphilis, destructive tendencies, aggressions, violent outburst, then and tubercular, restlessness, disobedience, craving for the change and excitement. We know that case taking matters in each and every case. So in case taking in children here, we take a full observational based approach because child can't express her or his feeling. So we can take a facial expression, gestures, body language, play patterns, interactions, reactions. Then the detailed parental input matters a lot. With parents, sometimes we take a history or observation from the teachers also. So birth history, developmental patterns, behavior at home versus outside, and coping mechanisms and family dynamics, sibling relationship and parenting styles. Then we take a history of mental and emotional sphere, and in which we focus on the fear, anxieties, jealousy, angers, shyness, repetitive behavior, obstinacy, sleeping patterns, dreams, reactions, then physical genders and personal history, then constitutional and miasmatic analysis. So our goal is to find out the simillimum medicine based on the totality of the symptom, temperament and individuality. So here we discuss the few cases regarding the behavior disorder in the children. A male kid, 7-year-old, and his chief complaint was the hyperactivity and cannot sit in a one place, frequent temper tantrums, then poor focus in the school, aggressive with the peers. So these things was observed by the parents since last 2 to 3 years. So we made a totality of it. Cannot sit quietly, irritable, aggressive when corrected, then sensitive towards noise, demands things, throws them when denied, then desires sweets and cold drinks, warm-blooded, and sleeps late and talks during sleep. So if we consider the behavior pattern, it is a case of hyperactive kid. Mostly it is related with the ADHD. Then repertorial totality was made. Mind restlessness, child hyperactive. Mind irritability, children tantrums. Mind destructiveness, children food desire, sweets and sleep disturbs. And we get the lot of medicine like Senna, Chamomilla, Tuberculinum, Hyoscyamus and Stramonium in a sequence by repertorial totality. We always correlate GNM conflict to find out the exact cause in a case. So over here, there is the motor conflict, which means the inability to control or be restrained, and biological response is the movement, and that's why children is hyperactive. So hyperactivity is a conflict of being trapped or not being allowed to move freely. And that's why he wants to move. Often it is triggered by the overcorrective parenting. So remedy was selected on basis of totality and the GNM approach. CINA, it was given in a 200 potency in a single dose. Personally, I consider 200 or 1 M potency in this behavior disorder of the children. And mostly I am giving single dose and waiting for 2 to 3 weeks for the response. So here, CINA is selected on the basis of irritability, temper tantrums, worm-related restlessness in a children. Because CINA kid is cross and does not want to be touched and look at, highly irritable and wants to move and desire many things and throws them when they are getting. So after 2 weeks, he becomes slight calmer and sleeping is better, talking is decreased in a sleep. Then after 1 month, temper, irritability is reduced, movement and restlessness is reduced, and he was able to sit in a class. Before that, he was changing class during running classes also. He was not able to sit in a running class. And after 2 months, aggression is rarely occasional, then it is improved. He is improved with his focus. And after 3 months, he improved academically, and a few complaints like sometime irritability or sometime abdominal pain was there. Otherwise, he was completely fine. So with the single dose of CINA, there is highly, we observe the very much improvement in this case. Case number 2, it is again related with the repetitive behavior or isolation. Mostly here in a behavior disorder, we find the many cases related with the male gender rather than female, because it is very much common in a male, and observe in 7 cases is related with the male and 3 to 4 cases related with the female. Usually we find this ratio. So here a female patient come around 5 years of age. She was not able to speak, avoids eye contact, constantly watching her parents, not to doctors, and flaps hands continuously and does not play with other kids and prefers to be alone and sit silently in a corner. Family history was delayed milestone in parental line. Totality was made absence of speech, avoidance of interactions, prefer solitary play, repetitive hand flapping, sensitive to loud noise, loves listening to specific music repeatedly, which is calm and cool, then craving for milk. Then repertorization, mind, elements from fright, mind, timidity, children in mild repetition of act, mind aversion, children company of, and desire of milk. So repertory totality shows the Baraita-Carp, carcinosin, natramule, stramonium, and tuberculina. Here GNM conflict is related with the identity confusion and territorial conflict. So it is the case of autism, and mostly it is related with the early shock conflict. It is transfer from mother to fetus during the pregnancy. So this isolation nature is the biological response by the kid. So remedy is selected on basis of the totality was carcinosin 200C and was given in a single dose. And carcinosin was selected on the basis of sensitive children with history of emotional suppression, love for music, dancing, and certain fixed pattern of life. Children with history of early suppression, perfectionist tendency, and fixed rituals, craving for milk and love music, it is related with the carcinosin. So mostly after the 3 weeks, we observe improvement in her sleep, and now she was doing a slight eye contact with the doctors and surrounding. Then after 6 weeks, he started repeating a few words. Then after 2 months, there is the reduced flapping and attention span is increased. After 3 months, she feels better and smiles when called by her name and start talking with the unknown persons. So at this stage, we repeat the 1 dose of carcinosin again, and later on we waited for more 3 to 4 months, and we didn't find any complaint regarding her improvement. Then case number 3, oppositional deficient disorder. A male patient around age of 9 years. His complaint was disobedient, argues constantly, fights with siblings, breaks things when angry. Her parent having a divorce before 2 years, and the separation conflict being activated in this male kid. So totality talks back to elders, angry when corrected, destructive behavior, sleep disturb, grinds teeth during sleep, fear of being alone, desire for chocolates and fried foods. And repetition, mind, anger, children, contradiction from mind, destructive, children, mind, fear, alone of being, mind, quarrelsome, and general desires for chocolate. And we find the medicines like anacardium, nux vomica, tuberculinum, hyoscyamus, and stramonium. So, as I told here, the conflict is related with the loss of parental unit protection that is leading to survival based defense. Then that's why it is related with the argues and quarrels, because it is related with the survival. So often post-traumatic aggressive behavior is due to the fear or emotional loss. So here is medicine is selected on basis of this is tuberculinum 200C, and it is again given in a single dose. So we consider tuberculinum due to the disobedient, restlessness, destructive children who feels confined or unsupported, constant need for the change, dissatisfaction, breaks toys and wants to go out. After 2 weeks, child broke a fewer items, but still was defiant. We waited for more 2 weeks. After that, there is less fighting with the siblings, and his sleep is improved. After 2 months, he was not giving back answer and was emotionally very expressive. Then we repeated this tuberculinum 201 dose again, and after 3 months, his school complaint is reduced, sibling bond was improved, and he improved with the surrounding, was not breaking any items and not giving back or wrong answers to the elder ones. Next, again, a female patient come around 9 years having a complaint of excessive fear of being alone, especially at night, clingy behavior with mother, refuses to go out to school alone, then complains of abdominal pain, stomachache before exams and public activities, frequent nightmares and disturbed sleep, sweaty palms, constant nail biting, restless leg movements, avoids social interactions, and prefers being at home. So totality was made on the presenting complaint: separational anxiety, anticipatory anxiety before performance or school or public attendees, then fear of darkness, sleeplessness with vivid dreams, Somatic complaints like abdominal pain, palpitations, nail biting, and sweaty palms. After repertorization, mind, fear, alone being, mind, anxiety, anticipation, sleep, dream, frightful, mind, timidity, general perspiration, hand palm, stomach pain, anxiety from. And we find the calcarea carp, silicea, gersemia, arsenic alb, and phosphorus. So here, fear and fright related conflict is activated, and anxiety stems from the perceived or real loss of emotional safety and protection. Now that's why child overhears the arguments between parents or fear of being left alone at home or school. So a remedy was selected on basis of this was Calcarea Carp 200, and it is due to the fearfulness, insecurity, aversion to socializing, sweaty palms, clingy nature, fears to be being alone, fear of dark, slow to develop confidence, sweaty palms, chilly patient, chubby, shy, emotionally depends on the parents. So after a week, we find a mild reduction in her night fears after 15 days. Stomach ache while going to school was reduced and patient is progressing. After a month, child attending school with less resistance, and we repeat again Calcarea Carp 200 single dose over here, and after 2 months he was she was able to attend a public event, and she didn't have any nightmares, fears, and fright. And we stop over here and just encourage the patient not to fight in front of her, because she needs supportive counseling, and on treatment base we giving only a placebo in this case. Then a male patient come around 8 years, and his complaint was persistent arguing with the authority figures, then angry outburst over minor issues, blames others for own mistakes, easily annoyed and often deliberately annoys other, disobedient at school, as the repeated complaint was coming from the school and home surrounding friends, then aggressive tone with the parents and teachers. So totality was made like defiant and argumentative behavior, anger with tendency to break rules, irritability and annoyance from contradiction, difficulty accepting mistakes, poor concentration, impulsive behavior, feels provoke easily. And repertorization, mind, contradiction, intolerant of, mind, anger, trifles about, mind, disobedience, rebellious, mind, quarrelsome, mind, responsibility, aversion to, and mind, blames others. And we find the Chamomilla, Nux vomica, Anacardium, Tarantula, and Lycopodium. So depending on the GNM point here, conflict is related with the identity and insecurity. Now that's why child perceives loss of control, injustice, or being constantly judged. And repeated scolding without validation of feeling at home and school due to various complaint or his behavior triggers the event, and birth of younger siblings leading to perceive a neglected change in him. So depending on this, we select the Anacardium orientale, giving in a 200 potency dose, considering disobedience, contradictory behavior, cruelty, conflict between good and bad impulses, and sense of inferiority and anger. So initial response was like there is the slight reduce in a frequency of anger outburst, improved ability to follow simple instruction, and then blaming to others is reduced, calmness is increased, And after the 2 months, he was very cooperative at home and becomes calm towards surrounding in the school with the friends. So after a month, we repeated anacardium single dose, and after 2 months, only the counseling is needed because he was becoming very much stable. Then again, autism spectrum disorder. A 6-year male comes with complaint of no eye contact, repetitive hand flapping and rocking, and delayed speech. Only repeat the words what he heard. Then does not respond to name, does not play with the peers. Then highly sensitive to sounds, even a fan, blender. Then fix it on the spinning objects like fan, like only a flipping toy. So totality was made on the basis of poor verbal communication, repetitive behaviors, lack of social interactions, aversion to touch and sound, obsessive behavior, fixation of routine. And repetition, mind, speech delayed, mind repeating, words same, mind company, aversion to, mind gesture, max automatic, mind sensitive, noise to, mind fixed ideas. And we find the Baraita carp, carcinosin, tuberculinum, buforana, and Haliborus niger. According to GNM point of view, here the self-devaluation or isolation conflict is activated, which is related with the sensory neurons. So protective withdrawal due to the overwhelming external stimuli, identity confusion from early sensory imbalance or any trauma like birth trauma, NICU separation. Originally, a separation conflict will lead to self-devaluation conflict over here. And on basis of this, we again giving a carcinosin 200 in a single dose. And on the basis of child who are sensitive towards music, sound, touch, obsessive behavior, then oversensitive, then precocious, perfectionist, fixed routine. So here we selected carcinosin to remove the emotional suppression. And after 15 days of follow-up, hand flapping was reduced. After a month, he started making eye contacts. Then after 2 months, he spoke 3 new words spontaneously and responds with his name sometimes. Then after 3 months, he sits calmly for longer periods and starts to play with the siblings and friends. Next is the conduct disorder. A 9-year male comes with the complaints of persistent aggression towards the peers, that is hitting, kicking, shouting, then stealing and lying without the remorse, then destruction of school properties, defines authority at home and school, poor academic interests, then cruelty towards the animals, insomnia, restless sleep with shouting at night. So parents both separated and child lives with his mother, and there is the history of early neglected behavior and minimum father contact. Now that's why over here also separation conflict is being activated, and he was exposed to the domestic violence in early childhood. Having there is no history of any major physical illness. So totality was made on the basis of aggression towards others, destructive behavior, defines authority, manipulative lying, and emotionally indifferent, lacks guilt, sleep disturbances. Repertorization, mind destructiveness, mind cruelty, mind lying, inclination to, mind quarrelsome, scolding children, mind restlessness at night, and mind sleep disturb. So we find the medicine Tarantula hispanica, Hyoscyamus niger, Stramonium, Anacardium orientale, and Varicella. So according to GNM point of view, there is a territorial anger or self-devaluation conflict. The child reacts with the territorial aggression due to the feeling of unsupported or abandoned by the authority, by the parents due to the separation and neglectation. And this will lead to hyperactive and combative behavior. So on basis of this, we selected Tarantula hispanica, again giving in a 200 potency single dose. And it was selected on the basis of extreme restlessness, impulsive destructiveness, cunning behavior, fast speech, movement, tendency of for the mischievousness without remorse, then violent anger, malicious, needs attention, strong affinity towards the behavior extremes with quick tendencies. And after 10 days, we observe a slight reduction in the hyperactivity, but he was still very aggressive towards the external stimuli. After a month, we observe there is no any physical fights at the school for last 1 week as said by her mother. After 2 months, improvement in her sleep, and he was expressing her emotions with the friends, teachers, and mother. So here we repeated Tarantula 200C 1 dose again, and after 3 months, there is the reduced destructiveness, cruelty, and started helping others, surrounding teachers, her mother, and he was emotionally very much responsive towards the her towards his mother and at the school. So here we giving only placebo. Next case related with the selective mutism in a kid. A female having a mostly having a complaint of mutism by the parents. So female around 7 years coming was the come with the complaint of the refuses to speak in a school or unfamiliar settings, speaks normally at home, fearful, anxious while attending any social events, physical trembling when addressed by the teachers, difficulty making friends, avoids eye contacts, occasional thumb sucking, frequent complaints of abdominal pain before school. He was single kid, overprotective. Her mother was overprotective in nature. Delayed preschool socialization. It is due to the COVID phase, due to the lockdown, and high parental expectation and competitive family environment was there, because in her family everyone was doing a government job, and there is no history of any trauma or abuse with her. So totality was made: speech normal at home, mute in public, anxiety in social setting, timidity, fear of stranger, anticipatory anxiety, psychomotor complaints, dependency on parents. In repertorization, mind timidity, mind silent, taciturn children, mind fear, stranger of, mind elements from anticipation, stomach pain, anxiety from, mind bashful, shy. Here we find Baraita, Cilicia, Pulsatilla, Phosphorus, and Lycopodium. Your self-devaluation plus danger, fright, conflict in a public environment is activated. Now that's why child having a mutism is a survival adaptation of her. By this, he becomes silent and passive, unsafe in unsafe environment, and she avoids any emotional threats or any emotional expression in public. So on basis of this, Baraita Cup was selected, giving an 200 potency single dose. On the basis of shyness, dependent, fear of stranger, delayed social maturity, avoids attention, emotionally immature, withdrawal in a public, and delayed mental and social development, fear of stranger, avoidance of new environment, highly dependent, and seeks reassurance from parent. So after 10 days, abdominal pain was reduced and she started speaking at school. Then after a month, Conversation with teachers and friends was started. Then after 2 months, he participated in a storytelling competition. And after 3 months, there is no fear, no anxiety related with attending school or any public event or any communication. Now she was able to speak with any stranger also. The next case is related with the sleep disorder. A 5-year male kid is come with complaint of difficulty falling asleep unless held by the mother, frequent night waking with crying, screams or talks during sleep, fear of darkness, then there is daytime fatigue, irritability, sleep restlessly, then history. The complaints begins after a change in a home environment. They shifted their home, and this change of place, change of surrounding affects him. So sensitive to noises easily started, cries if parents leave the room, and family history of anxiety, sleep problems. There is no history of any fear, head injury, or any neurological disorders. So totality was made like sleep disturbed with night terrors, fear of being alone, fear of darkness, sleep, talking and crying during sleep, clingy behavior, oversensitive to external stimuli, irritation in morning after poor sleep. And in reportization, sleep disturb, sleep, night terrors, sleep works frequently, then mind fear dark of, mind clingy children, mind sensitive noise towards. And we find a medicine like a stramonium, phosphorus, calcarea, capsina, and pulsatilla. So here the fear fright conflict is activated, and it is related with the visual and auditory cortex involvement. So child has experienced an unexpected or threatening situation, that is moving towards the new home or change of the home, that is leading to a lingering insecurity, especially at night when darkness magnifies the conflict. So on basis of this, we selected stramonium 200. Single dose was given on the basis of night terrors, fear of dark, vivid dreams, fear of being alone, shaking during sleep, clingy behavior, terrifying dreams, fear of darkness, sensitive to every noise, and sudden shrinking during sleep. So after a week, there is a reduction in night terrors. After 3 weeks, there is a child having a less complaint during the sleep. Then after 1.5 months, there is occasional night waking. And after 3 months, he sleep independently without a parent also, and having very much reduction in a fear of darkness, and he can be alone at home sometimes when parents are not there. Then the next sensory processing disorder, 4.5-year female patient welcome and having a complaint of hypersensitive towards touch and sound, cries when wearing certain clothes, refuses to play with clay and massive substances, covers ears during loud music, avoids crowded places, easily overwhelmed, has meltdowns. History having was a full-term cesarean section at birth due to fetal distress, delayed milestone, started walking at 20 months, and history of NICU stayed for a 1 week post delivery, and breastfed for 10 months, and mother had anxiety during pregnancy due to family conflict. So here the mother's conflict during pregnancy is shifted to her daughter. So totality: mind sensitive noise to, mind sensitive touch to, mind irritability from sensory overload, mind fear sudden noise, mind shrinking, skin unbearable touch of clothing. And repertory: mind sensitive noise to, mind sensitive touch to, mind shrinking children in, skin uncovering aggravate, mind restlessness from overstimulation, mind irritability children in. And we find chamomilla, carcinosin, belladonna, helleborus, and senicula. And here, tactile and sensory boundary conflict was activated, and that's why she was having a fear of being touched when one doesn't want to be. And on the basis of this, we selected medicine Sanicula 200, having aversion to touch, sensitivity to clothing, sound sensitivity, emotional meltdown, and withdrawal from the sensory inputs. So after 10 days, we find the mild improvement in her tantrums, and she can tolerate a soft clothes. After a month, he allows or finger painting with the guidance of fewer meltdowns. After 2 months, she was started playing with the play groups, and she was able to tolerate some sound. After 3 months, she was comfortable with external stimuli. So various cases are there related with the behavior disorder, as ADHD, childhood anxiety disorder, autism spectrum disorder, conduct disorder, selective mutism, sleep disorders. And on the basis of that, we have selected various medicines to them. As you can see, I'm mostly prescribing 1 m potency or 200 potency and single dose, and waited for too long, almost 3 weeks, 2 months, to observe the specific effects. So here the various cases are there. Then it comes in a mind how we can correlate the GNM theory with the symptoms, with the repertory, and with the medicine selection. So let's take a round trip towards the GNM theory, repertorial point of view, and what is the conflicts that are activated, how we can able to find out the exact cause, and we can find that in a medicine. And that things means the element factor or causative factor will help us in a selection of the medicine, and we will able to find a improvement in a kid with this activation of the various conflict levels. So various conflicts in a mother or in a kid are territorial fear conflict, motor conflict, self devaluation conflict, separation conflict, speech conflict, existence conflict. So if we consider the role of homeopathy with GNM, that is the biological conflict, as GNM says, if it is made with the dynamic healing of homeopathy, we will find the marvelous result in a various behavior pattern disorders, in a kid also, in an adult also. So in our last session, we have discussed this table. So I am not going in a detail with this table. So let's move ahead with the next. GNM homeopathy in a practice. So if the conflict is active, and in GNM we will find the stress and heightened alertness. And in this case, we find the medicine which calms the mental level of the person. So calming and grounding remedies like aconite pulsatilla and lecmaternum will be indicated. Then conflict resolve phase means the healing phase. We find the fatigue, inflammation, and emotional release in a patient. So remedy which are acting as a detox or integration like phosphorus, silicia, and carcinosin will be indicated. Then in a crisis phase or relapse, where there is the return of the acute symptoms, we observe these symptoms and shifting towards the positive shift or negative shift. We select the medicine on the basis of return of the symptoms. In utero conflict, if child felt abandoned, unloved, leguminum pulsatilla, he or she feels trapped in a situation, job, relationship, then Tarantula hispanica, cannabis indica, then constant anxiety about health or survival, then aconite opium, leg maternal, pressure to be perfect or family expectation than the carcinosin and silesia where performance is observed, than the grief and loss of loved one, ignatia, natramure and chocolate. Then in repertorial rubric, if it is related with the GNM, with the materia medica and behavior disorder, we find the motor conflict where the sensation of the kid like the I am feel trapped or unable to act freely. It is mostly observed in a ADHD, restless leg and fidgety and tics. So various mental rubrics we take related with this conflict like mind activity increase, mind restlessness, mind impulse and extremity restlessness of legs, and various medicine was selected on basis of this rubric like Tarantula, Zincamat, Agaricus, Madorinum, Tarantula, Hyoscyamus, chocolate, Zincamat, Agaricus, and Tarantula hispanica. The next conflict was the self-devaluation conflict. We discuss 1 to 2 cases related with the self-devaluation conflict. I am not good enough was seen in a low self-esteem, delayed learning, and withdrawal phase. And we are taking rubrics like mind confidence, want of, mind fear, failure of, mind timidity, best for children, mind dullness, comprehension of. On basis of this, we find the various medicines, some of the beige flower medicines like large leguminum, Silesia barettica, then Lycopodium silesia carcinosin, then Pulsatilla magmure sacrum officinalis, rare medicine like Bambusa, Calcaria fos, Anacardium, and Ginkgo biloba. Then separation conflict. I have lost touch with someone I love, seen in autism, clingy behavior, and detachment. So various rubrics here we take the mind clinging children to mother, mild aversion company to, mild indifference towards loved one, mind fear being alone. And various medicines are also related with this rubrics like Megmure, Cannabis indica, Haliburus niger, and Stramonium opium leguminum. Then speech conflict. I can't speak or express myself. Seen in a speech delay, mutism, as we've seen on a girl having a mutism behavior. So mind speech delayed, mind mutism children in, mind repetition of word sections, larynx voice, loss of emotional. So on the basis of this rubrics, various medicines are there: Baretta, Cicuta virosa, Buforana, Haliburus, Sacrum officinalis, Athusa, Anholium, Carcinosin, Causticum opium staphysaceae. Then the territorial or fear conflict. So there is a danger in my space, seen in a panic attacks, nightmares, and hyper alertness. Having a rubrics like mind fear dark off, mind anxiety night, mind stalling easily, sleep dreams frightful. And various medicines are there like muscus, chocolate, stramonium, lectin, belladonna, phosphorus. Then identity conflict. I don't know who I am. Seen in a role confusion, mimicry, and unstable personality. Having a mind delusion identity, mind delusion neglected she is, and mind delusion separated word from him. Having a various medicine, Falcoperginus, Thuja, Lecfelinum, Crocus, chocolate, Lecfelinum, and Cannabis indica. Then existence conflict. Am I safe? Will I survive? Having a anxiety disorder, bonding issues, and fear of abandonment. And rubrics are mind insecurity, sense of, mind fear, future of, general, food, milk, desire, craving. Having various medicine related with it like argentum nitricum, phosphorus, chocolate, leguminum. Then useful repertory sections for GNM based prescriptions like mind delusions, mind elements from, mild children, dreams, and in general milk, food cravings, touch, aversion. So these are the sections, repertorial section you can refer to find out the exact rubric related with the GNM separation theory or find out the exact cause for behavior of the kid. So our application strategy over here identified the dominant GNM conflict in a kid, then cross-match the rubrics in their repertory, then confirm the rare and dependent remedy and prescribe it in a single 201 m single dose and observe till its healing phase is started. Some non-medicinal supportive measures are to be done. Structural routine is fixed for the kid, like consistent daily schedule is made. Then positive reinforcement, praises and rewards will be given to them. Then calming techniques are yoga, breath exercise, and guiding relaxation. Then expressive therapies like art, music, dance, and drama. Then special educational support like remedial teaching, individual learning plan, and counseling was given. Parents counseling is very much needed, because they expect more from kids. They have to understand their child is very unique and having a different need than the normal developed kid. So please avoid punishment, and don't stick too much towards the discipline, and handle their emotional triggers. Then limit screen time, sleep time will be properly managed. Otherwise, they reduce the focus and becomes irritable. So offline activities are to be planned for them, and interactive play learning activity should be increased. Outdoor activity is increased. Some dietary preferences and recommendations are also there. So foods are given like brain and mood supportive food having rich in omega-3 fatty acids like flax seeds, walnuts, seeds, ghee, proteins like dal, lentils, paneer, complex carbohydrate like whole grains, oats, sweet potatoes, colorful fruits having a rich vitamins and antioxidants. We should avoid the foods like having a which increases the hyperactivity in a kid and emotional agitations, like refined sugar, artificial sweetener, caffeine, processed food, coloring food, and excess in a dairy food. Some of a food will increase the tissue source in a body, like kali phos supported by the bananas, sunflower seeds, sprouts, mac phos, legumes, almonds, green leafy vegetables, and kalkira phos by ragi, sesame, figs, and paneer. So general dietary guidelines was give them a warm, freshly cooked foods. Microwave meal should be avoided. Regular meal time should be maintained. Choose within a healthy options, and hydration should be maintained. In a specific disease condition like ADHD, autism, anxiety, aggression, some foods are preferred and some are avoided. In ADHD, please give the protein rich food and having a low carb in a food. Avoid sugary foods and artificial coloring food. Then autism, gluten free food should be advised. Dairy and wheat and processed food should be avoided. Than in anxiety, magnesium rich food like pumpkin seed and spinach was given, and chocolates and refined carbs are avoided. In aggression, cooling foods like coconut, cucumber, gulkan is advisable, and fried spicy food and soda should be avoided. So we are having a very much challenges to tackle this type of cases in our practice. So commonly challenges are difficulty and observation due to the non-verbal conversation with the children. So here we depend on the parents' description and observation during consultation, teachers' observation. So we will miss some important guidelines. Here, the parental expectation was very much higher. They expecting quick and dramatic changes in their kids with homeopathy, and this will lead to lack of patience in them, and this will lead to a discontinuation in the treatment. Then time-consuming follow-ups like detailed case taking, gradual subtle changes, monitoring, and record keeping is needed. There is a need of the multidisciplinary collaboration like speech therapist, occupational therapist, child psychologist to find out the exact conditions of the kid. Then the social educators are needed who who understand them and make them learn new stuffs. And homeopath should be open towards the interactive care. There is a major role of teacher and parents. parents should understand that kid is very special, so they can improve the home environment, observe and report exit changes in their kid, and giving a positive reinforcement towards their kids, and having a become emotionally connected with their kids. And for teachers, there is a behavior changes needed towards them, because they need a special attention, special educational support, and they need a confidence building activity with their teachers by the appreciation on a small achievement. So some of the clinical tips are there for using a remedy, like if polycrest is not working, then consider deeper lesser known remedy, like a child treated with the phosphorus for oversensitivity, fear, dark, but symptoms are returned. Then in deeper case, give the crocus sativus in a single dose, it will act. Then usual outline behavior, like peculiar, rare, strange symptoms are difficult to get. Then if the observe these small things in a kid, like talks too much but avoids eye contact, think about simsifuga, becomes silent and weepy, prays, consider lectin, licks, smells, then sanicula, then sudden affections, crocus, hyosymus, explosive anger, tarantula. Then non-verbal developmental delayed, eye contact, gesture, repetitive behavior, sensory triggers. Consider anholinum, where dream like a withdrawal out of the body behavior, agaricus, jerky, clumsy, giggling, motor, sensory behavior. Then bambusa for delayed in speech, dentition, growth, and emotional maturity. When emotional themes or cone bound feelings we can find, like feeling unloved, deprived, sacrum officinalis lecuminum, obsession for control, falcoporginans platina, then craves attention, hyosymus, attention, alternating mood, moscus. Then we will find the specific traits also. When family history is stronger, please prescribe the nosode as an intercurrent remedy, like madorinum and tuberculinum. Uh, if having a dominant behavior, inherent dominant behavior, think about milk or placenta remedy like mec maternum and lec humanum. In children with this spiritual and sensory activity, having a high moral or having a more maturity than his or her age, think about the falcon, think about the chocolate. If spiritually sensitive person is there, if ditch feeling is there, think about the cannabis indica. Feels misunderstood by word, think about the lec felinum and lec delphinum. So over here we conclude our session with this child behavior disorders are multidimensional, having a emotional, mental, physical, and environmental factors. So homeopathy offers a safe, holistic, and individualistic approach focusing on treating child, not just a disorder. So over here, careful case taking, miasmatic understanding, symptoms totality, proper repetition is needed with the parent-teacher support, with non-medicinal support, and we can achieve this with the this whole stuff. We can achieve emotional stability, improves in a social interaction and academic performance, and lead a more balanced, fulfilling life. So every child is a star waiting to shine. The right care and patience and understanding, we light the way. Thank you all.
Thank you, doctor, for the excellent session. And you like doctors, homeopathic doctors is really a boon, because the mainstream medicine is being just dealing all these with speech therapists, occupational therapists, special teachers, psychologists. All persons are just beating the bush and not getting the right track how to treat these cases. Homeopathy marvels. And doctor, you are really just, we are very thankful to you. And a lot of persons will be here to interact with you. But the thing is, we don't have enough time. Another session is to be is waiting. Another session is there in Malayalam. So next time we will be able to interact with you further. So on behalf
Yes.
of IFPH, I thank you for this wonderful session. And I urge and I ask you to again come to the floor with more insights. And I thank you all who were here, who are attending this wonderful session. And you can watch this session in YouTube. This is the second part of the session, and first part also, it's in YouTube. Thank you. And over
Thank
to
you, sir.
Malayalam. Yeah.